Used for narcolepsy but gave me bronchitis. Yo, what's up? It's someone that's no one, and welcome back to today's report. Today's report is coming from Ravenblades off Arrowwood, where she took GHB and some other inhalant medications. And here's the full report details. Alright, welcome back to another GHB report, this one being a strongly medical one. We covered GHB in the past and showed how much it can be used in a recreational setting, how much of a unique downer it can be. But here we're showing how those effects could realistically help with something, like major sleep issues, in this report, narcolepsy. But while this may be the case, substances can carry risk and side effects, and unfortunately for this user, she had asthma and allergies, which had actually worsened these symptoms so much it gave her bronchitis for 2 months. Definitely not something many would expect from a depressant like this, but it's always crucial to look for side effects and just how you are personally going to react with a substance. There's also some inhalant substances that come up that were used to help settle out the bronchitis. But when she stops the GHB is when she finds out what the culprit actually is. So this is pretty insightful and one I'm sure you'll enjoy. So without further ado, let's dive right into this. I am prescribed GHB under the pharmaceutical name Xyrem in order to treat narcolepsy. A brief background on narcolepsy and therapeutic use of GHB for sleep disorders. Narcolepsy is a condition in which the hypothalamus fails to provide a significant amount of hypocretin, a chemical that regulates sleep. Sufferers experience uneven sleep patterns such as insomnia and excessive daytime sleepiness, muscle weakness, cataplexy, hypnagogic hallucinations, and sometimes sleep paralysis. Even with 12 hours of sleep, someone with narcolepsy may still fall asleep at inappropriate or often unsafe times. This aggressive fatigue occurs because the sufferer's body never completes all 4 stages of sleep. GHB helps alleviate the symptoms of narcolepsy by condensing sleep into just a few hours. The patient must take 2 doses, setting an alarm for 2 to 4 hours after the first dose. Its distribution is controlled by the central pharmacy. This is the only pharmacy that can distribute the medication, which is mailed directly to the patient. The treating physician, usually a neurologist, will often have to pull some strings and write letters to the patient's health insurance provider in order to get coverage for Xyrem. The central pharmacy keeps in contact with the patient and doctor in order to monitor health problems, possible dependency, as well as answer any questions patients and doctors may have. The central pharmacy also helps collect research data directly from the patients in regards to the therapeutic use of GHB. When I began my Xyrem therapy, I loved it. Not only was my sleep solid and peaceful, allowing me to discontinue using my stimulants during the day, but the high was great. All day I thought about going to bed and the euphoria of Xyrem. Shortly after starting the Xyrem, I began to experience acute bronchitis. There is a health warning from Xyrem that states that you should not take the drug if you have any lung disease or respiratory problems, because the medication suppresses breathing. My doctor and the Xyrem pharmacist both assure me that even though I have asthma, Xyrem will be safe for me to take. I originally attributed the bronchitis to my asthma and to the fact that I was also working at a childcare center. I was treated for the bronchitis twice, both times requiring antibiotics, and the second time requiring prednisone. I was using my rescue inhaler, Albuterol, 2 to 3 times a day. At one point, I was crumbled up on the floor having an attack and almost unable to breathe. My chest had been tight all day. I also began noticing that when I woke up, my breathing was unusually suppressed, and I had a sinking/hollow feeling in my chest. That's the best way to describe it. My allergist put me on a high dose of Advair mist. After 2 months of suffering from bronchitis, I decided to try not using the Xyrem for one night. When I woke up, my breathing was almost normal, so I tried it again the next night, and my breathing was even better the next morning. At this point, I called my neurologist and told him I was discontinuing the Xyrem and resuming my old medication routine of Seroquel at night and Prednisone in the morning. By the next week, the bronchitis was almost gone, and I've been breathing great ever since. I should also note that another side effect can be the sinus problems. I already have regular allergies, but while on Xyrem, my nose was constantly congested with thick mucus, and I did get one sinus infection. The sinus problems also cleared up after stopping Xyrem. I would still strongly recommend GHB as a treatment for people with narcolepsy, so long as they don't have any respiratory problems, including asthma or allergies that affect your sinuses. It really is the best sleep I ever got.